Welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Rory Alter, with my lovely co-host for this month on the podcast. We are talking all things related to the core and pelvic health here in the powerlifting and barbell training realm. So I'm back with my lovely co-host, Dr. Bree, here at Progressive Rehab and Strength. She is also a clinical coach with us. And in this episode, we are going to bust one of our favorite pelvic health or women's health, even though men can do these also.
Yes.
So we typically say pelvic health, but typically people associate the Kegel with a female, but men can do them also. So we're going to bust the myth that Kegels are this fantastic magical exercise that will cure all pelvic floor related issues. So Bree, actually, before we dive into that, I want to just read a listener question that we received from one of our followers on Facebook and Instagram, and she listens to our podcast too. So she submitted a question related to Kegel. So I'm going to read that quickly, and then we'll answer that. Hopefully this episode, this myth busting episode, will answer that question, but we'll make sure we answer her question specifically. So this is from Ricky Quinn. She asked us, if a woman says she leaks when she sneezes or when she jumps, do you have her do exercises like Kegels? Do you refer her to a pelvic health physical therapist? Would you worry about making things worse when the weights start getting heavy? And how about for women in general? Do you believe everyone should be doing pelvic strengthening relaxation exercises, even if they don't have symptoms, since odds are that a high percentage of women do eventually develop these symptoms? So this is a very packed question.
A loaded question,
It's a
Ricky.
loaded question, but it's a really thoughtful question because it's a very common belief that Kegels are the answer, that if you leak, you should do Kegels, and it's not always the answer. So, Bree, what is a Kegel and what is the purpose of a Kegel?
Yeah. So first, Ricky, thank you for your question. This is a great question. And let's take it piece by piece, because if you don't know, I am pregnant, and I was just telling Rory, I have pregnancy brain to the max. So let's take it piece by piece so I don't miss any of your questions. So first off, your question, the first part is, Rory, you said, what is a Kegel, and should everyone be doing a Kegel? So I hate to, and as we get through these episodes, you'll hear me saying this a lot, that it just depends, because everyone it's individual for everyone. So first off, what a Kegel is in general, it's just a general name for a pelvic floor muscle contraction. And if you have any questions on what the pelvic floor even is, definitely go and listen to our functional anatomy podcast episode, because that dives deep into like what exactly pelvic floor and what these muscles are and what they do. So first off, refer back to that. But a Kegel is just a contraction, the name that we have for a contraction of these muscles. So I don't know why someone decided to give it a fancy name for these muscles compared to like any other muscle in our body, but the Kegel just has its own fancy name because it's in this pelvic area, I guess, and it's more of a mystery for most people.
I
So
know, like a bicep curl is a bicep
yeah,
curl. Why we have to call a pelvic floor contraction a Kegel? Like, should we come up with some fancy name for a bicep?
I think so, honestly. Exactly. So
it's just so the Kegel, there are some exercises that are named for the person who, like a Pendlay row or a croc row. Like those are all people who came up with that exercise. So
for that specific muscle group,
Dr. Kegel,
and it truly is like that is
and he's
true.
a male.
Yes, came up with this Kegel contraction. And so to sum it up, no, everyone should not be doing Kegels, in my opinion, because most, at least from my experience, seeing women and men and women in person, actually assessing their pelvic floor muscles, a strength, their problem is not usually a strengthening or contraction problem. Most people have more of a relaxation problem. Not always, but so in a general sense, no, most people should not, everyone should not be doing Kegels. And I was telling Rory this, that like, even if you're told to do Kegels, it might not be the wrong thing to do, but most people don't even know how to do them correctly. So think of any other muscle in our body. A contraction also comes with a relaxation of that muscle. So a muscle, reflexively relaxes after contraction. So if we are forgetting with the Kegel, if we're thinking just tighten, tighten, squeeze, flick, do all these,
Mm-hmm.
these squeezes, and we don't relax, that can, that can lead to a problem in and of itself, or not be the resolution to, your
Yeah,
problem. So
so I want to touch on that a little bit because we'll talk a little bit about pelvic powerlifting, urinary incontinence, and how the Kegel fits in or doesn't fit into addressing incontinence in a female powerlifter. But what happens, because you also mentioned it's usually not a strength issue. So what happens when people forget to or don't relax their pelvic floor or any other muscle, when we have
yes,
constant tension or constant contraction of a muscle, which can happen with anxiety or stress or fear or whatever, um,
protection, anything that you,
protection, yeah, we get this reflexive constant contraction and therefore a lack of resting in the muscle, and that can build up a high level of fatigue in the muscle, and that's when the muscle starts to fail because it's tired and it can no
correct.
longer sustain the appropriate contraction. And so we'll see that in programming in women who are experiencing incontinence in powerlifting. It's not that their pelvic floor isn't strong enough. It's usually a mechanical issue, which we can talk about on another day, which we actually have an episode talking about powerlifting urinary incontinence. So mechanical issues, you can go listen to that episode, and I'll link that in the show notes. But when there's too much accumulated training fatigue, or there's too much volume or intensity in a specific training session, the pelvic floor is our weakest link and it can't sustain those contractions anymore. So that's when it tends to fail. So just going back to the associated relaxation with the Kegel, and it not usually being a strength issue, it being more of a relaxation issue or tension issue. I just wanted to talk about that real fast because I think that
Yeah.
that's such an important piece that people miss. That if you're just constantly contracting, you have to assess, and like you said, it always
Yes.
depends. And we always
Just
in
depends.
it just depends. Like in our podcast intro, we say it depends. If you go listen to our first episode on the podcast, we say it depends. Um,
And it's true, but
you have to assess, why is that person failing to maintain their urine? Why are they leaking? Is it that they actually aren't strong enough? And we can talk about what populations might experience a weakness, but or is it a fatigue issue?
yes.
You know?
And so I always use this as an example to kind of put it into perspective. Imagine you're going to, train, and part of your training session includes squats. Okay. And imagine if between every set and every rep of squatting, you do a wall sit,
Mm-hmm.
and you just do a wall sit, and then all day you just did wall sits. Like, how well would your quads and your glutes and all of your other, movers, stabilizers work? How well would they perform under after having all of that accumulated fatigue? And again, with the pelvic floor, we don't usually have a lot of awareness in that area. One, just because it's muscles, they're muscles that we don't visually see. So, in the mirror, when we walk by a mirror, or we walk by, we're sitting, we can see our upper traps or our shoulders being pulled up to our, towards our ears, or we can usually feel our belly being tight, or etc. But those muscles we don't usually have a great awareness of, and where they're at, throughout our day or during our training. So if we're not, letting those muscles go, or we're just really focusing on squeezing, tightening, whether that's what we're told to do, or we're thinking, I don't want to leak, so I'm just going to hold these muscles and get
Mm-hmm.
them stronger, etc. Again, exactly what you said, that fatigue, just put that into perspective. If you're constantly holding tension, just like if you're constantly holding tension in a wall sit, those muscles are not, regardless if your training program is a perfect fit for you, um, that's not, your muscles aren't going to be able to perform under that fatigue. And then if your program is not, adapting it, or if you're not adjusting your program to that fatigue or recovery, or that need for recovery, then that adds another layer onto, again, fatigue and those muscles not performing the best that they can.
Okay, so let's talk quickly about how the pelvic floor functions, because we've already talked about it in our functional anatomy episode, but just when you're standing here, just kind of
Yes.
relaxing and you're not peeing, like you're
Hmm.
sitting in your chair and you're not leaking, you're walking around and you're not leaking. What is your pelvic floor doing?
So your pelvic floor is just how we said one part of your inner core. So it's directly linked to your breathing and directly it's a stabilizer. So putting that into perspective, every breath you take, that pelvic floor is moving and should be moving dynamically with that breath. So it's kind of as you breathe in, almost think of like a piston. As you breathe in, that pelvic floor should drop and relax to an
Mm-hmm.
extent. And then as you exhale or you're just, letting your air out, that should return back to its kind of resting position. Um, so that's how the Kegel or the Kegel, gosh, that's how the pelvic floor muscles are working
so
in general
so
at
how
rest.
so how come like you and I are sitting here right now and we're not leaking? Why are we not leaking?
So could be for many reasons. For us in general, one, for most people that leak, it involves usually a pressure or increase of intra-abdominal pressure or some kind of physical demand that this core needs to match or withstand or provide stability for. So, a lot of times when we're just restful sitting, there's no stress or strain or demand placed on this system. So,
Mm-hmm.
is there really like, we do have resting tone in these muscles, and that's at rest. These muscles are working kind of as obviously as posture stabilizers, so they have like a level of resting tone,
Mm-hmm.
and that's what holds our urine back, as
Mm-hmm.
well as our bladder is a muscle. So those muscles work opposite to each other. So when the bladder is relaxing and filling up, the pelvic floor should be at a lower level contracting to let that urine fill up. And then oppositely, when we're going to void or empty our bladder will contract and our pelvic floor muscles just reflexively with neurologically should relax.
Mm-hmm.
So it's a neurological function,
Mm-hmm.
and as well as there's just no real demand placed on it, so we're not really requiring, I guess, resistance
Mm-hmm.
against that urine
Mm-hmm.
beyond that resting
Gotcha.
point.
So, what type of person is going to experience a true weakness deficit in their pelvic floor? Like, what type of person walks into your office? Because, like, typically the power lifter is not going to be the person who has a
That's
weakness in their
weak.
pelvic floor, right? A
Yes.
weakness in their pelvic floor. So, what type of person or what general symptoms might they have? What is their demographic, their age, their health status that walks into your office who might have some type of leaking going on related to weakness in the pelvic
A
floor?
true
A
weakness.
true weakness in the pelvic floor.
And that's the thing, pelvic floor muscles, again, how we talked about, can appear weak if they're fatigued. So this is a true weakness and I would say most people again don't have this weakness problem, but the people that do usually have some sort of trauma to the pelvic floor. So someone that maybe have just given birth had a lot of either tearing or they just had multiple babies, big babies, have had experienced any like sexual trauma, or any trauma to the pelvic floor area, whether that was a traumatic like a car wreck or
Mm-hmm.
some kind of trauma to that area, that these muscles have the brain body neurological connection. There's something off and we need to truly strengthen these muscles,
Mm-hmm.
as well as again someone with a maybe other neurological, other underlying conditions.
Mm-hmm.
So someone that has a disruption in that, or just a problem within that neurological
Mm-hmm.
sense, that we
Mm-hmm.
need to actually strengthen these muscles because they have not been used, or
Mm-hmm.
not even used, but they have not been, someone that's even been, and I don't want to say bedbound, or that
Mm-hmm.
has
Mm-hmm.
been bed rest for a while
Mm-hmm.
for whatever reason, an injury, a surgery,
Mm-hmm.
whatever, someone that truly is deconditioned.
Mm-hmm. Yeah, no, I totally agree. And, we start to experience it, typical. changes in your collagen and your tissues and your muscles as you age, that like age
Yes.
related changes to the pelvic floor are usually a weakness or a neurological issue.
You know
Uh,
what's funny though is you would think I've had, and I think my oldest patient that I saw in person for pelvic floor PT that I physically assessed their muscles was like 88, 89, and she did not have a weakness problem. Like she
well,
wasn't a
that's
fit,
why,
active person,
yeah, but
but
that's why we always say it depends,
yes,
so, but no, I
yes,
totally agree with you. It's typical, like if we're going to
yes.
kind of give it a
General,
demographic,
yes.
we don't see the weakness in the 18, 19, 20,
Mm-mm.
30 year old who hasn't had a baby or any trauma to their pelvic floor or change to their pelvic floor. That's usually a fatigue issue,
Mhm.
mechanical issue
Yes.
related to training. um, but but even the neurological, there, yeah, I mean, even when we say neurologic, like it's, we have people who have memory
Mhm.
difficulties. They develop slowness in their movement as they get older, and it's more of like they're leaking because they just don't remember, or so there's so many different types
Yes.
of incontinence, and there's functional incontinence, which is more related to those neurological or memory or ability to actually get to the bathroom fast enough. And in those situations, Kegels won't be appropriate.
Mhm.
But so kind of going back to when are Kegels appropriate,
Yes.
go ahead and tell us when Kegels would be appropriate.
Usually Kegels are most appropriate when there's more of a problem in and of the system. And what I mean by that is those muscles are not coordinating the way and working the way they should. So we need to almost retrain that muscle memory for these muscles to work, contract and relax how they're meant to work.
Mm-hmm.
So I use a Kegel as a one as an awareness. So like to bring that awareness down to those
Thank you.
muscles.
Thank you.
um, and then also to retrain, just getting that, coordinating that system. So beyond that, I mean, other than just checking in with yourself and saying, oh, am I actually relaxing these muscles? Let me do a Kegel, contract, relax. Oh, no, I'm not. So I need to work on relaxation. Other than that, though, no, like it's that's more of like the general, and the way I look at it is it's more general function of that muscle. So if you're looking to progress, like to train or progress that muscle function or strength or endurance even further, that's where we need to then incorporate that normal function into progressive barbell training,
Thank
progressive
you.
strength training, something that we're
So,
loading that
okay,
muscle group.
so I love what you said about using it as like an awareness, or re-education, and I
Yes.
think it's like, okay, so we teach someone how to squat, but we're not going to put the bar on their back before we show them
Yes.
how to squat, before we make them aware of the position and the movement and how they're
So
supposed to
good. Yeah.
execute, right? So the Kegel, and I'm going to ask you another question about the
Yeah.
Kegel, which I love to discuss. But so the Kegel, I love that you said it's like an awareness exercise. It's not the answer, it's the start. For
Yes, that
someone,
just like you said about squats, like what are you going to do 1,000 air squats to progress your squat? No, you're going to load it. You're going to, there's all these different ways to progress it, but
right.
that
Yeah,
just doing an air squat with perfect form is not the answer to getting stronger in
stronger,
your
right.
yeah.
So when there's a pelvic floor issue of related to weakness, we first have to check that someone is able to actually, that they're aware of their pelvic floor, because most people are just not.
Yes.
In the normal healthy young individual, you don't need to be aware of your pelvic
I
floor
was
because
just
it's
going to say that.
right, it's functioning appropriately. Our body is designed to function appropriately. But then when there's something that interferes with the function, that's when we step in with Kegels. They're not a preventative exercise. I think that, let me go back to this question that Ricky asked. Okay, so how about for women in general? Do you believe everyone should be doing pelvic strengthening relaxation exercises even if they don't have symptoms? And this would be our answer to this would be no. Because,
Yeah.
I mean, at least from my perspective, I'm not 100% sure what you're, I mean, I think we need to be
So,
aware of how our
yes, I
body
was just
functions. And we need to use proper breathing mechanics. We need to use proper lifting mechanics. We need to have a proper program. And I think that with a young, healthy individual who has no symptoms, that's going to be the way that you prevent issues from happening in the future. Does that make sense?
Yes. And what I would, going off of that, exactly what you said. So no, you shouldn't be doing, everyone should be doing Kegels to prevent. However, think of we're human. Like, we have stress during our day. Some days are more, we were just saying how May has
Mm-hmm.
been, a crazy month
For
already, and
both
it's
of us,
already,
yeah.
yeah, it's
We're
almost
like
over.
overbooked
Like,
everywhere.
yeah. And it's just like, okay, so there's going to be times that we might need to bring our awareness, recognize that, hey, I'm more stressed, or I have more going on, or I'm running around, or I'm just, whatever the case is, during those ebbs and flows of life. Yes, we might need to bring more awareness back to those muscles, and like focus a little more on like letting go, and
Mm-hmm.
maybe utilize the Kegel to like get that full let go, and whatever. But no, like in
I
general,
think that's a really great example or concept or idea, because let's just talk about stress in general, because you know for people who don't have a pelvic floor issue, they might experience their stress as a tension headache, or
yes.
a low back pain, or
Yeah.
constipation, or diarrhea, or tension in their jaw. So like we tend to hold tension in our body when we're stressed in wherever our weakest link is, right? So and kind of bringing, just recognizing that we're stressed and saying, let me just take a few minutes to decompress, de-stress, meditate, or do some type of deep breathing or something that relaxes us, that allows us to
Mm,
decrease the tension that might be leading to our tension area. So for some people, and we can talk about the whole connection between like TMJ, tension headaches,
yes.
and pelvic floor. But if you're recognizing tension in other areas of your body, use that as a check and say, let me relax. Let me take 10-15 minutes to just throw on some chill music, do some deep breathing, relax, read a book, something to decompress our stress so that we're not leading to chronic tension or chronic holding in those areas that shouldn't be contracting. And that's when we get the fatigue in the pelvic floor.
And then think of this, most people, and I hear this so often, that when I'm more stressed, or when I'm whatever, my symptoms are worse.
Mm-hmm.
Well, what then happens is we worry about our symptoms. So we
Mm-hmm.
add more stress, and then
Mm-hmm.
we leak more, or we have more pain, or more heaviness, or prolapse, or back pain, like, whatever the case is, we experience more of that. So then that feeds into this like fear, tension,
Mm-hmm.
cycle. And it's just, yeah, it's very interesting. Again, we're all connected, and in a
Mm-hmm.
great way, because we don't just fall apart, but
Right.
we're all
No, it's good to
connected.
it's good to have, we do have resting tension or resting tone in our body, which is important for our body to work appropriately. Like things don't just shut
Yes.
off. That's a whole other concept, right? Things don't just shut off. The pelvic
Mhm.
floor doesn't just shut off. It's always working. And that's why we get tired in some of our muscles some of the time,
Yes.
but yeah, so just to kind of where did I want to go with that? Um, to go no no to go back to this like awareness concept, right, and it being the starting point and it kind of being the foundation for strengthening, right, just the action of it and being aware and moving appropriately. How Why then, you said like we don't just do 1,000 air squats to get stronger. Why isn't the Kegel the answer to strengthening your pelvic floor, and how do you strengthen your pelvic floor?
So just referring back again, the pelvic floor is just one group of muscles in a bigger system. So our inner core, foundational core, whatever you can refer to it, a bunch of different things, but that component of the inner core. So you want to strengthen the pelvic floor as a group with its
Mhm.
teammates.
Mhm.
And again, refer back to the functional anatomy to talk, referring back to its teammates, but to fully strengthen the pelvic floor as it's meant to, strengthening it in a way that it's uh, strengthening its function as a
Mhm.
whole. You want to be progressively overloading that system, um, in a dynamic way, in a functional way, with progressive resistance. And that
Mhm.
can look a lot of different ways. Obviously, barbell is like a main way, but you could use, kettlebells, dumbbells, resistance bands. There's all different ways to
Mm-hmm.
progressively
Mm-hmm.
overload this system. But a lot of people will ask me like, oh, the Kegel weights or the pelvic weights, like that's loading them. It's like, well, okay, you might be adding like a little bit of resistance. It's probably not even as much as when you cough or sneeze or something.
Right.
Like that
Exactly.
resistance isn't really
It's not
much.
meaningful.
Yes. And on top of that, you're not, again, I would use those as more of an awareness tool to help you get better in tune with the position of where those muscles are.
Mm-hmm.
Having resistance helps you, you know, having something against your muscles gives you more of a cue. So I
Mm-hmm.
use that, if anything, the Kegel weights or the vaginal weights or, whatever pelvic weights, I would use those as more of a cueing
Mm-hmm.
tool.
Mm-hmm.
Again, but to really strengthen these muscles, we need to be strengthening
The system.
them. Yes, the whole
Mm-hmm.
system in itself.
Yeah, and so I love what you said. So kind of to tie this into barbell training and like why a Kegel isn't the answer to someone doing like who has powerlifting urinary incontinence. So, go back to our powerlifting urinary incontinence to understand what that actually is. We're not specifically but you can apply this to anyone who has a pelvic floor dysfunction, especially a
Yes.
weakness in their pelvic floor. It's going to come down to properly engaging the pelvic floor while barbell training and applying progressive overload in a sense
Yes.
that doesn't cause too much fatigue to
Mhm.
then lead to a failure of the pelvic floor. But, it's like the pelvic floor does not work in isolation ever.
Correct.
Like it just
Correct.
doesn't. So we shouldn't strengthen it in isolation
Yes.
because
So great.
it's not ever going to be able to lift as much weight independently and in isolation as we're going to lift. Like you said, a cough is
Resistant.
more resistance to the pelvic floor than a, like a insert can ever be,
Yes.
right? And you can't use an insert or do a Kegel is never going to match the 450-pound deadlift that you're going to do. So we have to start at a load that doesn't cause too much overload to our pelvic floor that it fails, right? So for the powerlifter who's experiencing incontinence, and you've worked with so many of our powerlifters, or basically we refer everyone who comes to us for a pelvic floor issue, we refer them to Bree, and she will work with you guys. But basically, like, you identify the load and position that someone's experiencing symptoms, we back off. Obviously, we do the awareness stuff as well, but we back off. It's like fixing someone's technique on a squat. If they're having hip
100%.
pain or if they're having back pain, we're going to modify the position for them, but we're also going to modify the load and the program. So the frequency, the volume, the intensity, so that your symptoms don't express themselves, right?
And so then we're progressively training them with the rest of your muscles, just like again, we talk about our big movers and then our
Mm-hmm.
stabilizers. Like we want, you've said this so many times, Rory, that you're only as strong as your weakest link.
Mm-hmm.
So
That's where I was
you,
going to.
yeah, you want to be strengthening and progressively strengthening that inner core and the pelvic floor equally, or not even equally, but just as right along with those
Mm-hmm.
prime movers. And I loved what you said about that's not even how the pelvic floor functions in isolation. So why would we train it in isolation? Um,
Yeah, this, like, I always tie the pelvic floor to grip strength on the deadlift. When you're deadlifting, for some people, their weakest link is their back. Their
Mhm.
back gets so round that they can't lock it out at the top in competition. Or for some people, their weakest link is their grip. They fly up with the deadlift, they lock it out, but then they drop it because their grip is too weak, right?
Mhm.
So for some people, it's like the load is moving, but they're pissing themselves.
Yes.
So it's the same concept of, okay, so how are we going to strengthen our grip? We're not
Do a
going to
bunch
do
of hand opening and
right, we're not going to
yeah.
get like a grip strengthening device and squeeze it all day long. That's
Yes.
actually going to that's going to make our hands actually too tired to deadlift later, you know? And then we're going to start dropping things over and over again. What we're going to
Yes.
do is we're going to find a load that we can lift without dropping, and we're going to build up from there. And we're going
Yes.
to do the same thing with the pelvic floor. Of course, it's going to be awareness. So for some people, you know, with the grip, it's like finding, okay, double overhand doesn't work for me. Does hook grip work for me? Does mixed grip work for me? You know, does this much chalk, or this, like, how often do I need to chalk my hands? How many times per week can I deadlift without my grip starting to fatigue? Do I need to use straps on my accessory exercises so that my grip, you know, and we figure all that
Yes.
out to find out
Troubleshoot all of it.
exactly, to find out how much your pelvic floor can handle, and we have to build up from there. So kind of going back to where we started in the context of PUI and strengthening the pelvic floor, the Kegel is the starting point, and it's an awareness exercise. It is not a strengthening exercise.
Amen.
Amen. Oh, love it. All right, let's just make sure we answer the question.
Okay.
Oh,
Yeah.
we kind of didn't. So if a woman says she leaks when she sneezes or when she jumps, do you have to do exercises like well, we did answer that question.
Yeah.
The answer is always it depends. Yes, we should refer this person to a pelvic floor physical therapist, because while it's common,
Does
it is
not
not
mean it's
normal,
normal.
right? So if you're leaking at all in any context, powerlifting, sneezing, jumping, coughing, running, laughing, you know, in the middle of the night, like whenever, if you're leaking, definitely see a pelvic health specialist, pelvic health physical therapist.
Yes.
Before you even go, like, you can see a pelvic health physical therapist before you go to the doctor, because to be honest, they're gonna spend
Don't
more
get me on
time.
a soapbox.
Yeah, they're gonna spend more time with you. They're gonna we physical
They're muscle
therapists.
experts. Like they're
Yeah, they're
in that
muscle
area.
and neuromuscular experts. They are going to spend way more time with you figuring out what the problem actually is. They're going to give you more strategies than just a pill or a surgery
Yes.
or whatever, or just tell you
And get
move
to
your
the
booty
root
weak.
of,
Yeah,
yeah.
exactly. And okay, so yes, everyone should see a pelvic health physical therapist. And would you be worried about making things worse when the weights start getting heavy? I would. You want to
Yes
answer
and
this? Go.
no. Like if
Right.
you're doing everything appropriate in the
Right.
sense of progressing and you're programming and your fatigue and that and your form and
Hmm.
all of that, then no, like
Right.
absolutely not. Like it's so interesting because so many women, especially again, I work with men as well, but so many women experience this just more often. And these women I work with, it's so interesting to see how like where they start with when they have their symptoms and all of that. And then as they progress, it's like, I feel great. I rock this. I hit this PR and I didn't piss at all. Like,
Hmm.
and it's like, yeah, that's because you're supporting that system and supporting that progression as appropriate. So
Yeah.
most times, and again, this is going into another conversation or another discussion of like surgery and pills and like
Hmm.
what all treatment options there are. Most times, again, not everyone, but most times it's a dysfunction problem, not as much of a structural problem.
Hmm. Hmm.
And when you get that system working and functioning the way it's meant to, it's going to support you doing these things. So especially again, I know pregnancy is a super easy example to compare to, but people will often say like, oh, you shouldn't lift this much in pregnancy, or you shouldn't do this. And like just generally, and it's like, well, no, like yes and no. Like, yeah, if you've never lifted, you know, 150 kilos and when you're
Yeah.
pregnant, yeah,
Right. Don't go
don't do
doing
it.
that. You know, you have to, if
Yeah.
so a pelvic floor dysfunction, whether it's pain or it's fecal incontinence or urinary
Prolapse,
incontinence,
anything.
prolapse, anything. We apply the same principles that we apply to managing injuries in training, you know?
Yes.
And can you make things worse? Sure. If you go balls to the walls,
Yeah.
YOLO, are training at too high of intensity, too high frequency, doing your technique is all over the place or not the right technique for you,
Mm.
all of those things can contribute to symptoms of any kind.
Yes.
Pelvic floor related dysfunction or injuries that like back pain, shoulder pain, knee, anything, right? So if you've got symptoms of pelvic floor dysfunction, reach out to a pelvic floor physical therapist. And Kegels are not the end all be all. They are a neuromuscular re education and awareness activity that we can
Yes.
do that will never match a 450-pound deadlift. So we have to get from that awareness all the way back up to the 450-pound deadlift in some way. That's appropriate.
Yes. And a side note as well, a lot of, and again, not all, this is never, it's not always or never, but most pelvic floor PTs, and this is why I just like, I love that Rory and I like that we met and it's fate. I feel like
I
that
know.
our paths crossed, and just because there's not many people that this gap is bridged
Mm-hmm.
between physical therapy and barbell training and powerlifting and weight training. So if you have specific questions, again, that are beyond that, oh, I cough, laugh, sneeze, and leak,
Mm-hmm.
definitely, also reach out to us as well, because this is
Mm-hmm.
where we bridge that gap. So a
Mm-hmm.
lot of, if you find that, again, there, it's just figuring out what combination and what's best fits you and your symptoms and
Mm-hmm.
what you need individually. So yes,
Right.
pelvic PT and or bridging that gap of barbell
Yeah.
training specifically, we are here for you as well.
Yeah, there's no one size fits all answer to any injury at all.
Yes.
So if you're like, if you find like a free PDF on the internet that says like fix your urinary incontinence, like maybe to some degree that will
Mhm.
help you, but it will not be like help. I mean, if it totally helps you, great. But like
Yeah.
everybody like the human body is just so amazing and unique, and everybody's body
Yeah.
responds totally different, has a different movement and response and reason for why they're experiencing symptoms. So if you're unable with all the things that we put out there on on this topic, if you're unable to resolve your symptoms, definitely reach out to us. You can book a free call. That link will be in the show notes. You can also join our free Facebook group, the Secret Society of Barbell Mastery, because sometimes it's technical and, it could be your belt. We go listen to our powerlifting urinary
Yes.
incontinence episode, but please join us in the Secret Society of Barbell Mastery because we can do a lot for you in there with our Q&As, our free form checks and all that kind of stuff. Get on our weekly newsletter because we do excuse me, we do free literature reviews every month. We do a free case study presentation every month as well. So we have a lot of stuff out there to help you learn about powerlifting and implement things that can keep you safe from experiencing injuries and incontinence in powerlifting. So that was a long-winded Kegel myth busting episode, but yeah, we're not against Kegels, but we are not like they're not the answer
Not
in
the
most,
end all be all
not
for
the end all be
everyone.
all. Exactly. Just one piece of the puzzle. All right.
Yes.
Thank you for this lovely episode. Thank you for your questions, Ricky, and we will see you guys next time. Bye for now.